Teeth discoloration is one of the most common dental problems that people face. And that is what we are going to talk about today, courtesy of Dr. Joyce Gitangu of Dental Smiles, Harvard educated. Very nice to have you on this segment. Yes. And yeah, what we are talking about is teeth discoloration, understanding the causes, of course, if you can prevent, and the treatment or treatment available.
Right.
Dr. Joyce.
Yeah.
Good to have you.
Thank you for coming to visit us here.
Beautiful place.
Thank you.
Beautiful place.
Very fun and very colorful. Yeah.
You know, especially for kids, I would imagine how they love it here.
Yes, they do.
But back to the conversation of the day.
Yes.
Teeth discoloration.
Yes, yes.
I can imagine if I am an adolescent going through that, and my classmates are there telling me,
Yes,
I can imagine how that can affect somebody's self-esteem.
It does, yeah.
The point of our conversation today is to understand teeth discoloration, the causes, of course, and then, like we said, prevention if you can, and the available treatment.
Right. So teeth discoloration, of course, they do occur two ways. We have something called extrinsic, which is from outside in.
Right.
And then we have the intrinsic stains, which are from inside out. Yeah. So extrinsic stains are obviously easier managed. So those are the ones that are caused by some of the foods we eat. So something like foods that are high in spices, turmeric and all that, will cause those yellow stains.
But temporary, right?
Right, temporary, yeah, it can be washed. Then of course we have things like wine and coffee and teas that will stain your teeth. Then of course we have like something that is called plaque. They call plaque-induced stains. Plaque is just that bacteria that remains on your teeth, especially if you've not brushed properly, and it stains your teeth. They look yellow, right? Then of course, we do have now the intrinsic stains. These are the ones that are caused by things like drugs, and of course some of the systemic fluorosis that we're seeing.
Wait, when you say drugs, in our minds, when you say drugs.
Yes, okay.
But what kind of drugs?
Yes, of course, medication. So there are some medications, like a lot of antibiotics that have caused stains. I don't think they're being used anymore. However, there are some, some drug medications that cause stains. They'll cause either a gray or dark tilting.
Right.
Then of course we have trauma. Trauma is another reason for
discoloration.
Yes, for discoloration. Yeah, so you get either a yellow or a black color.
My son has that. He fell down from the bed. So
exactly.
Yeah,
yes. So it just so the nerve is slowly dying. So that's why the tooth kind of takes off that color. So as far as extrinsic stains, they're very easy to manage because you just have to brush properly. Of course, we say it twice a day with a proper technique, and cleaning in between, because sometimes when people have stains in between their teeth because of that. Then of course there's some stains which have to be professionally removed by some of the materials that we use to clean them. And we've seen a lot of patients who even come thinking, oh, I need whitening, my teeth are so yellow. And once they've just had a simple cleaning, their teeth are much whiter, they're much more brighter. And actually it's usually a good motivation for them to come back every 6 months, because they know they don't have to stop having their favorite wine or taking their coffee every day or their favorite teas.
Because I then wanted to ask you, how do you have a conversation with a coffee lover?
Yeah.
Like, stop having your coffee because then of course it stains your teeth.
It does stain your teeth, but those stains are not permanent.
They come twice a year and I'm sorted.
Exactly. Then of course there is the plaque induced, like we talked about, which is caused by accumulation of bacteria that gets trapped underneath your gums. So usually there's a yellow build-up that you can see on your teeth, and a lot of people, sometimes it hardens, especially with adults, and we call it tartar or calculus. And that one is very hard to remove at home. So that one has to be professionally removed. We call the process scaling, all right?
There's no way of removing tartar at home?
No,
salt or something?
You can't. Because some things like those that people are not using at home, like the charcoal toothpaste or some peroxide. They're very alkaline and they become very corrosive to your enamel. So they will cause other issues like teeth sensitivity in the future.
Right.
So it's important to kind of, be
Get
be
it
very
professionally done as well.
Professionally done. We also do hear people who are doing their whitening at home. We also have to be careful because
what are they using?
Yeah, I mean they're using some very acidic materials, some very corrosive things that kind of wear down. They erode the enamel, which is kind of very protective to your teeth. So just come see your dentist, get your teeth cleaned, get them polished. The teeth surface become very smooth. So even for your next cleaning, you'll notice it won't even be it won't be very hard, because now the ability of things to stick on the surface of your teeth is harder because the surface is much more smoother. So eventually, for people we've seen who periodically come, they usually have a very low amount of stains because they're used to coming every day.
Okay.
So that is one of the ways we just, handle. There's one I have to mention that I've noticed a lot. It's something called chromogenic stains. So these are little black stains I see in very little kids between the age of 1 and 5. And it has something to do with a bacteria, chromogenic bacteria. And it's usually found in water and sometimes some foods that we eat. And what it does is it combines with saliva, which contains iron, and forms these black stains, and a lot of parents really get worried. But it's
I've never seen, by the way.
Yes, it's a very unique stain, but I've seen it a lot now in Kenya. And it is just as simple as just getting it cleaned. Some parents have to bring their children even every 3 months to get those stains cleaned, but they don't cause any problems. And usually a child, as they get older, they start disappearing.
That's
so
good to know.
it's not
That's
something to worry about, but it's
Okay.
something that's worth mentioning.
Focusing on one of the forms of discoloration, I know fluorosis is something that is a concern for a lot of people. It's something we never think about, but it's something we need to think about. What is my source of water?
Right.
And speaking from a parent's perspective, it's something I wish I knew, because in one of the areas I lived, the water was borehole water. And you're thinking, yay, we don't have water problems. I live in a cool place.
Right.
But then borehole water apparently has a lot of fluoride.
Yes.
Then you become, say, expectant as a mom. You're consuming that water. Already that fluoride or fluoride is affecting your baby, and you don't know. Educate us on matters fluorosis. How do we become more self-aware or become more aware about it? What can we do when we are pregnant and beyond?
Yeah, so one thing I think you mentioned was the borehole water. Sometimes people think all borehole waters contains high fluoride levels, but it's not the case.
That's good
There are
to know.
some areas which are very endemic with having high levels of fluoride in that water. But either way, when you have, if you live in an area where you're using a borehole, you can just take a measurement of that water, and see how much fluoride is in there.
How do you do that?
You just take a sample and then you send it to people who specialize in water filtration systems, and then they can tell you, that the level is too high. This one is not. Then they can take the certain approaches to. Yeah, but so that is a disclaimer, so that so people don't freak out.
Yeah, that all borehole water is bad.
Yeah, we do have areas which are very specific. Yeah, but dental fluorosis is pretty much high fluoride that gets deposited on your teeth and bone, right? And it is usually caused by foods, right? Water, and even sometimes industrial waste that we are breathing and ingesting, toothpaste. Of course, when you take excessive amount of fluoride in your toothpaste, it's ingested, especially when you're under 6, it will cause dental fluorosis. After 6, you will see some enamel discolorations. You'll see a yellow spot, a brown spot. Some of them are more extensive than others. You'll see little brown lines on the teeth, or a chalky white surface on them. Fluorosis not only affects your teeth, it can also affect other parts of your body, like the bone and your joints. But usually the first sign you will see is with your teeth, right?
Interesting.
But in more extensive amounts, then you will see it more in your body.
Dr. Gitangu, if you can break it down for us, as now that we've talked about the causes of teeth discoloration, what we can do to possibly prevent, what are the solutions? Because when you're walking around and your teeth are discolored, makes you feel, for most people, of course, it will make you feel a certain type of way, and you want to find a solution. Top of mind, tooth whitening. I like the part where you said it's better for us to come in for professional
evaluation.
So that could be something that is one of the solutions. You mentioned the other one that we need to schedule to come in for tooth cleaning.
Right.
So that's another one.
Yes, it can change, you know, it can brighten your teeth, even those small little specks, they can actually come out just with a simple cleaning.
There you go. And which are the other ones that you can break down for us?
So also the solution obviously depends on the cause, right? So of course if you're exposed to high fluoride levels from your drinking and cooking water, then you must stop the exposure, right? Because it would be redundant for us to be able to treat or, you know, cover your teeth, but you're still exposed to high levels of
same
fluoride.
water. So change the water you're
so one is just changing your source of water. Either use bottled water or get filters. You know, it can either be a chemical filter or, you know, a mechanical filter, but whichever way, we have to stop the exposure. That's number one. Then if there's other exposures, such as, you know, from foods and medications that you're taking, or, you know, other nutritional deficiencies, then we need to address those type of solutions. But as far as the cosmetic ways of covering some of those stains that, you know, become very crippling, especially to, you know, young children who are so sensitive, you know, other kids are laughing at them, telling them your teeth are dirty, you know. We can do simple procedures depending on the extent. If it's just a mild type of fluorosis, there's a new type of treatment called Icon, which is so it's just like it's kind of more of a chemical, a chemical removal of those white stains. It's minimally invasive. It doesn't require any drilling of teeth, as we previously have been doing with kids. A procedure called masking, where we clear off part of the, you know, the stained areas, and then we place filling on top just to kind of cover those spots. As they get older, obviously for adults, also because they're affected, we start thinking about things like whitening.
Whitening. From what age can you do whitening? I'll
just say after you're 18 years old, you can do
whitening. So nothing below?
Because the chemicals are very strong, and, you know, for some of these teeth, they're just still maturing, so we don't want to expose them. And also just the efficacy of the whitening products has not been tested on young children, so I would stay away from that.
Okay.
So the beauty is we have Icon now, so it works the same as whitening, but just to a certain extent. Then we do have, obviously, for more permanent coverage, as you know, of course, you know, over 18, we talk about things like veneers. Veneers is like a ceramic little glass thing that you place on top of your tooth.
What's the difference between veneers and crowns?
Veneers is just, you just do a very minimal reduction of the area that is affected.
Right.
Then you just place the veneer on top. And then the crown is more of a full coverage, and I've had to do it with certain patients, especially when their fluorosis is extensive. Their teeth are so brown that, you know, doing a veneer will not, because light will still pass through and you'll still see the stains. So we do full coverage crowns.
All right.
But yeah, so those are like the type of treatments right now that are available.
So to wrap it up, the solutions to, I mean, if anybody is walking around or has teeth discoloration, it's something that you can sort out. You don't need to feel like you're doomed for life. And of course, teeth confidence, body confidence, if you're okay walking like that, it is fine. But then there are solutions out there for you. We mentioned masking, there's Icon, you can come in for cleaning if it's, you know, something that is a bit mild.
Right.
So it's good to know that there are solutions out there.
Yeah, and then also importantly, also sensitizing the community about the source of water.
Absolutely.
You know, from the get-go when they move to a new place or when they're building, to just be sensitized. You know, is this water, you know, high in fluoride, or does it have other elements that could, you know, cause a problem? Because now after a certain time, we can be able to. That's part of our assessments. When we talk to a patient, we always ask them where they live, and we put that your place of residence purposely, so that if you tell us if you live in,
we know,
I will question you. But then also noteworthy that, you know, the Nairobi city water has the optimum level of fluoride, which is supposed to be below 1 parts per million. and that's what it should be, 1 parts per million and under.
All right.
Right.
Thank you, Dr. Gitangu,
You're
for joining in this conversation. I mean, teeth discoloration, we can talk about it for a long, long time.
Right,
But I hope for the
yes.
people who are watching that you've learned something, and we thank you for your expertise.
Thank you for allowing me to talk about it. It's something that I'm also very passionate about.
Awesome.
Right.
Dental Smiles is the place you come to if you're looking to come in for cleaning. And like we've said, prevention is better than cure. There's no shame in coming in to have your teeth checked. Twice a year should be the minimum that you do so. So that is something that you need to schedule in. Thank you for your time. See you in the next conversation.